Hi, everybody, and thank you for joining the ILCM storytelling session today, which is going to be led by one of our members, the HepatitisB Foundation. Now, the HepatitisB Foundation is a patient organization dedicated to finding a cure and improving the quality of life for millions of people affected by the hepatitis B virus worldwide. We're very excited to have them here with us because they run an incredibly successful storytelling program, and they prepared an intensive all-in-one workshop for you, hoping that by the end of it, you are then equipped with more skills and knowledge to collate powerful stories and put faces on liver cancer. It's also worth mentioning that the tactics and experiences that you're about to hear today are also very much applicable to other disease areas, which makes this session even more important. Now, before I start, I just want to do one little thing very quickly, which is to tell you who the ILCM is. ILCM stands for International Liver Cancer Movement, and we are the first ever global movement in the field. We bring together representatives from patient groups, from academia, medical associations, representatives from public health institutions, pharmaceutical companies, etc., to identify gaps and to co-create solutions, but also to share experiences, much like what we're doing here today. So you can find more about the ILCM at ilcm.global, but for now, what I'd like to do is really to focus on this amazing workshop. So why don't I just go ahead and introduce you to these great speakers that we have today. With us, we have four amazing women. So we have Cook Fu, the HepatitisB Storyteller. We have Rhea Racho, it's the Program Director, Advocacy and Engagement at the HepatitisB Foundation. Also working at the HepatitisB Foundation, we have Yasmin Ibrahim, Senior Public Health Program Manager. And we also have Amy Hill, Silent Speaks Director with StoryCenter. Now, Amy has been supporting community engagement and well-being through storytelling for over 15 years, and she has been collaborating with the HepatitisB Foundation on their storytelling program. Ladies, thank you so much for being here. Really very much appreciated. Now let's just kickstart this session. And what I'd love to do now is just hand it over to Yasmin. Hi, Yasmin.
Hi, Raquel. Thank you so much. And thank you for this introduction. I'm so excited about this webinar today because it's such an important topic, such an important thing. I personally connect with many of the stories, and through my work, I do respond to email consults that we receive from all over the globe. We get about 2,500 emails per year. People living with hepatitis B and, of course, hepatitis B related diseases and liver disease. And we receive their questions, thoughts, and sometimes venting. And what we see from many of these emails is the lack of awareness about liver cancer. And we also see that in many regions in the world where hepatitis B is highly prevalent, liver cancer is also prevalent, and it's affecting people at young age. It's affecting more than one family members in the same family, and there's definitely a need for awareness about liver cancer. So this is something we see, and it conforms and aligns with many of the studies done in these regions. I also think storyteller program or storytelling is an important aspect because people connect with others who are going through the same experience. Again, through those consult emails, we always receive emails about people who would like to connect with the storytellers. We've received emails from many young people who would like to connect with David because they would like to have a conversation about how he was able to go about starting a relationship and going through the difficult conversation about the hepatitis B status and with a potential partner. Someone who is pregnant and would like to connect with the same person who's gone through the same experience. Someone who who felt empowered by Jason's story. So it's really very important and relevant to this, although not within the same topic, but like relevant. I also conduct public health research into the diversity of participants in hepatitis B clinical trials and community research. And we see lack of diversity. So we do need a lot of voices from all over the globe. With this, I will stop. I'll give the mic to the real experts and heroes of storytelling, and I will hand it over to Rhea.
Great, thank you, Yasmin. So again, I'm Rhea Racho with the HepatitisB Foundation, and one of my roles is actually getting to manage our national and international storytelling campaigns. Our national program here in the US is branded as #JustB, and our international campaign called Be the Voice is slightly newer, and I'll talk about that a bit more or a bit later in the webinar. But I wanted to start by giving an introduction to our first storytelling campaign that was launched in partnership with StoryCenter back in 2017. So it's a national multilingual storytelling campaign that shares true personal stories of people directly affected by hepatitis B. And we do this first through the creation of digital stories or videos that we put up online, but we also create printed materials and written stories. And we invite the participants of the workshops that we'll talk about in a bit to also continue to be engaged in in-person storytelling for different audiences. Again, we launched this in 2017 in partnership with StoryCenter and another organization called the Association of Asian Pacific Community Health Organizations. And just as a note, because I think this question does come up sometimes, but we do get funding for these programs to continue these programs both through HepatitisB Foundation donors and also through educational grants with industry partners. When we launched the campaign, the goals that we set out for it were to increase awareness and advocacy around hepatitis B, to help combat stigma and discrimination, to promote testing, vaccination, linkage to care and treatment around hepatitis B, and really to help engage people with lived experience, to speak out and help educate the public, to inspire action and to empower not only themselves, but the communities and their families that are also affected by hepatitis B. Our storytelling workshops, I won't go into too much detail myself here since we do have our partner Amy to share more about the details, but I did want to show a few pictures of the groups that we have brought together at the workshops over the years since we launched in 2017. And it's a really amazing experience. I think that the stories that you'll see on our website, the videos, really just would not be possible without first the community building and the trust that is built first within these groups of people who maybe have never shared their story about hepatitis B before, and just don't know how to go about it and may feel hesitant to do so. So I think the environment and the training that happens at these workshops is so important, especially with something like hepatitis B or other disease areas that may really make people feel isolated or stigmatized sometimes. Just the first step of coming together before you actually then decide, to put out a video about your whole story. This is really, really important. But I'll go into a little bit more detail here just about what we've achieved over the last few years. So between 2017 and 2022, we have hosted with StoryCenter 6 workshops now for 41 participants from 21 states and 1 person who joined us or 2 people who joined us from Canada. That has translated into 41 digital stories, 21 of which we've been able to translate into 13 different languages. So when our storytellers come to us with the ability to, or the desire to share their story in their native language as well, we are able to record both versions with them. We also have a lot of ongoing engagement through national and local storytelling and speaking opportunities, and we provide training and support beyond just the workshop. And then we do from the HepatitisB Foundation, and we try to do regular program evaluation to help us decide like how we can improve the videos or how we can improve the process for future participants. The way we promote the stories is mostly online. With the videos, we feature them. We feature one story per month and do a lot of kind of focused attention around it on our website, newsletters, and social media especially. We also try to connect our storytellers and highlight their digital stories in other media outlets. So not only our own blogs and things like that, but partners who are looking for stories to share. We highlight quotes from the stories in relevant other, press releases or interviews or events or awareness days that are happening. Just last month with Liver Cancer Awareness Month, we highlighted stories and we talked about the importance of this, and we try to connect people to relevant experiences related to, like I said, last year, Liver Cancer Awareness Month, or we have World Hepatitis Day in July, and we have Hepatitis Awareness Month in May. So there are a lot of opportunities to promote the stories at different times. We also have the printed materials that I mentioned, postcards and posters that kind of share shortened versions of the stories when we go to in-person events or advocacy events, testing, awareness, and outreach events. And we've even submitted some of the videos to public health film festivals or local film festivals and done our own local story screening events as well. Here are just a few examples of some of the social media graphics we've designed and that we use to promote and try to drive people to the website to watch the full story and to watch the videos. Here are just some pictures of, these are everybody in these photos are storytellers who have come after the workshops and decided, that they felt like they really wanted to get more involved. So they've come out to DC for advocacy days, spoken at conferences with us, and just really, really gotten to be front and center in some of our education and advocacy events, which was exactly one of our goals, was to identify and find people who are willing to share their experience and provide the opportunities and the support for them to feel comfortable doing so, and to meet other people living with hepatitis B who are advocating as well. Some of the ways that we try to evaluate the program is by looking first at just the actual number of video views and how many people we reach through different social media platforms, different media coverage, or different media outlets. And we do try to look at, which stories resonate, which languages get a lot of views, which ones are most useful in different communities. We also have put out surveys and done follow-up phone interviews with storytellers after they participate in the workshops to ask them about their experience. And I have some quotes from that on the following slides. We try to find out the impact on viewers as well. And so far, the way we've done that is through surveys as well at in-person events. And I've got a couple of quotes from that as well that I can share. And then we do try to follow up with partners that use the stories or help disseminate the stories for health education events or testing events and things like that, and just kind of get feedback from them on a regular basis on, what else would be helpful and how are you using the stories, and does it help you connect with your communities or with other people living with hepatitis B? So we try to gather that on an ongoing basis. But more formally, the last time we did kind of a formal survey and phone interview process, we had, what was it on the last slide? We had 18 who completed the surveys and 23 who did 1 hour long phone interviews with us. So we did a qualitative interview process. And we found, that the majority of people responded about how participating in the workshops and sharing their story, participating in the workshops helped them feel more comfortable about sharing their story and more interested in getting involved in community organizing or education. So storytelling was just sort of the first step. And then through the interviews, we we actually did a qualitative analysis and found these 4 themes were kind of what we wanted to highlight, and that was just outreach, emotion, education, and stigma were things that people talked a lot about in the interviews. So some quotes from that. I won't read all of these, but they're really helpful to see how, you know, the workshop, for example, the second quote, the workshop was a blessing for them. They had felt isolated and disconnected before. Now that they see how Hep B has affected others, they feel a sense of family and inclusion. And I think that's something that we love to hear, but it's just something that we know is so missing from the community. And I know that applies to other disease areas as well. When you're faced with a diagnosis that you don't know that much about, and you don't hear other people talking about it, it can be life-changing to then sit in a room and hear other people sharing their stories in this way and kind of inspiring you to speak out more so that there is more education and more advocacy around the disease. This quote is actually quite similar, talking about feeling very lonely after first being diagnosed, but then meeting other people who have the same struggles, experience, and fears. That was incredibly powerful and definitely something that I didn't know I was missing. So with the story screening events, I'll try to go through this a little quickly, but it was something we did a few years ago, pre-pandemic, where we worked with coalition partners to incorporate a video or 2 into one of their local maybe it was an education event or even a hepatitis B testing event. We asked them to see if they could incorporate a short program where they showed a video or 2, and if possible, if there was a local storyteller in the area, to be there as well, to share their story in person. And then there was a survey that was handed out afterwards, and 74% of those survey respondents reported an increase in their hepatitis B knowledge after attending an event, and 86 on average agreed that the stories themselves kind of increased their understanding of these different factors, aspects of hepatitis B, including transmission, risk factors, prevention, treatment, or the populations impacted. And I think some of the comments that people left on those surveys are more kind of more enlightening, just talking about how hearing first-person experiences had an impact on them that made, I guess, learning about the topic of hepatitis B more accessible than just hearing about it from a clinical or a third-person perspective. Another person said it was very informative. Now I understand how important vaccinations are, and it's an important topic to discuss. Another person talking about the stories being extremely powerful and how pairing these with data and key messages made it a very effective presentation. So I'll leave these up here as well for a couple seconds, but I do want to say that it has been really helpful for us to have this feedback and to know. I think when we launched it, again, we knew that this is what was missing. A lot of people think of hepatitis B as a silent epidemic, that there are not that many people willing to talk about it, and it's just can be misunderstood. And so I think storytelling in a lot of ways has opened up opportunities for the HepatitisB Foundation to reach people and share health education information in a new way. That has been really, really cool to see how this has grown and how this has helped impact all of our work. But we could not have done any of this without our partner StoryCenter. So I would like to pass it over to Amy Hill from StoryCenter, who leads all of the workshops and helps, produces the videos, works with our storytellers, and has been our partner on this for the last six years. So I'll turn it over to Amy.
Thank you so much, Rhea, for that great overview. So before I talk specifically about digital storytelling, I wanted to give a little bit of background on StoryCenter. So maybe we could bring up all the bullet points here. So we're an organization that has been around for more than 20 years. And for people who've used the term digital storytelling, for us, it refers to a very specific participatory media workshop methodology, which I'll talk about just in a moment. We've worked with organizations around the US and across the world. We've probably helped more than 10,000 people tell stories at this point. And what we really specialize in is community-based engagement through digital storytelling. So working with communities and groups who wouldn't otherwise have opportunities to tell their stories as short form media pieces. So I think we could go to the next slide. So I wanted to just say a little bit more about why personal stories are so important with digital storytelling. Of course, the ways that people's personal stories can touch on emotions and broad themes in ways that statistics and facts just can't is relevant. Also, when somebody tells a really personal story from their heart, it can create a sense of connection and intimacy between the storyteller and viewers, which can really open up people to receiving information and feeling compassionate and empathetic. Certainly, we always really support our storytellers in going to a place of truth and vulnerability that helps their story come across as honest and real in a way that kind of slick, overproduced media often doesn't feel. And then lastly, we really like to stay away from explicit messaging within stories because we feel like people are just barraged by media messages and public information kinds of messages telling them what to do all the time. And nobody really likes to be told directly what to do. And we like to convey information in more subtle ways through the beauty of personal stories. So that's a little bit of just context for why we focus on personal stories told in people's voice from their own direct experience. So I think we could go to the next slide. So digital storytelling is our most popular methodology at StoryCenter. We support people in really reaching into their own experience for a story that feels meaningful. We have done lots of work in the public health sector, both in the US and globally. And for us, the process of creating stories is really just as important as the final media that's created. So as Rhea has already stressed, we bring people together in small groups for the JustB project. And it's a way for them to connect and heal and bond with each other. And in this process, they are able to develop leadership capacities that kind of prepare them for then speaking out and sharing their stories in interesting ways for advocacy and education and so on. So that's a bit of broader information about digital storytelling. I think we can go to the next slide. And then this really is a quick overview of what actually happens within our workshop. So Rhea mentioned that we've done a number of workshops now with JustB, and the basic template of our workshop approach is just this, what you see on the slide. So when we work in person, our workshops are typically about 3 or 4 days in length. When we work online, it's about the same duration, but it's spread out over the course of a number of sessions held over several weeks. The first step in digital storytelling is really helping people decide what personal story from their own life they wish to share. So it's not really a methodology that works well for having people tell their whole life story. We help them distill down into a very specific story that will work for the given project. And to do that, we use one of our curriculum methods called 7 Steps of Digital Storytelling, which helps people really refine and get to a story that feels meaningful for them and helps them kind of craft it in a way that will work for this particular format. And then we do what's called a story circle, which of course owes a debt of gratitude to Indigenous communities around the world. It's kind of that age-old tradition of bringing people together to share stories and offer each other feedback and support. From there, we move into script writing and audio recording. So our facilitators work closely with our storytellers to kind of fine tune and really craft their stories into about 300 or 400 word scripts. And then we do audio recording. So we don't film people using video cameras because we've found that that can be somewhat intimidating. And so we just record people using simple audio recording tools, microphones, and so on. And then the next phase of the workshop process is helping people figure out how they want to visually represent their story. So we work with them to identify family photos and archival photos that they may already have, and to gather those and get them scanned if they're not already digital. And we also work with them to get creative about producing new images. So rather than kind of passively downloading material from the internet, we support people in really exercising their artistic capacities, and we work with them to create art and to shoot video clips and photos that can work for the stories. And then finally, we actually teach hands-on video editing. So we have a partnership with a wonderful video editor called WeVideo, and it's a really user-friendly tool. So we guide people through a simple tutorial that shows them how to use this to piece together a really solid rough draft of their story. And then, of course, every workshop ends with a screening of those draft stories and a celebration and a chance for people to really talk about kind of the next steps with finalizing their stories and how their stories might be shared. So that's our basic template. And I do just want to mention that with our various public health specific projects, such as the JustB project, we work really closely with our partners at the foundation to come up with appropriate story prompts and themes that help people kind of zero in on a story that will be powerful and relevant for this particular campaign. So, that's how we kind of customize the workshop process given our various partners. So I want to now turn it over to one of our storytellers who's going to talk a little bit about the experience. And I think we're going to watch her story first. So thanks so much.
I was always Daddy's little girl. In this picture, he's holding me when I first came to America. He had been a soldier in the Vietnam War and had to escape to America in 1981. A year later, my mom, sister, and I escaped by boat to a refugee camp in Indonesia. He was able to find us and sponsor us to bring us to Minnesota, and worked for years to help others find safety like we did. He and I are so much alike, except he was always stoic and upright, and I was always throwing my arms around him, whether he liked it or not. Even though my siblings may disagree, I was his favorite. He knew he had hepatitis B for many years before he was diagnosed with liver cancer. It's pretty common in the Asian communities, but no one talks about it. He was the same way. He never told us he had it. Maybe because he thought people would gossip and treat us differently. They would be afraid to shake his hand, share our food, or even be in the same room with him. I can understand why he was afraid to say or do anything about it. Maybe if we had resources in our language, people could be educated and more of us would know better. And I might have been able to help my dad sooner. When the doctors told him he had 6 months to a year to live, he didn't let that stop him from doing what he loved. This picture was taken on our last trip to Hawaii, his favorite place. He said they had the sweetest tasting Logan here. He was in and out of the hospital a lot, being poked and prodded. But he never complained. He always just smiled. And sweet-talked the nurses into giving him apple juice. He knew he was dying, but he chose to live until the very end. Always with a gentle smile.
Just be courageous.
Thanks for sharing that, Amy. I still get teary every time I watch that video. My father had passed away in October 2016 from liver cancer. And that's when Dang Tam, one of our community members, who's the program manager of the HBI Minnesota, had invited my sister and I to participate in the storytelling workshop in California. I think California has 2 new ponds made up of all the tears we shed during the workshop. But it was important for us to let people, particularly in the Asian communities, to know about HPV and prevent losing family members the way we did to something that could easily be diagnosed and treated if caught in time. I didn't know was that I also needed this opportunity to honor my father and grieve my loss. The storytelling workshop was exactly what I needed. The first day I spent learning and getting to know all the other members of the cohort as well. We were able to tell our stories to each other openly because we all understood how HPV can impact our lives. Then subsequent sessions, like Amy had said, we had a professional team teach us how to build storyline to tell our story and work with software to record and edit our videos. So the whole process was enabling us to, to do everything ourselves. This workshop enabled us to tell our stories in our own voice as well as language on the deadly impact of HPV in hopes of reaching to large communities and raising awareness. I came with a lot of loss and grief to the workshop and left with a community and tools to advocate and fight for and fight HPV so that other families and other family members will not undergo the same thing. One of the biggest problems, which I shared in my video, was that we didn't know that my dad was sick until he couldn't hide it anymore. And that's because we have a culture of not talking about our sicknesses, because speaking about health concerns may manifest it into reality. We also have a strong norm of keeping personal matters private, because if others knew, they would gossip about us. One of the biggest fears that people would think that HPV was only contracted either through sexual transmission, which means that you were promiscuous, or through drug use, and then treat us differently because of that. And one of the kind of the biggest push for us to do this is that this norm, the stigma that is associated with HPV was probably one of the reasons why he didn't share it with us. And if he had let us know earlier, we could have convinced him to get a liver biopsy earlier, and thus in hopes of having a better prognosis. So we had to share our stories in hope of normalizing HPV as a common condition in the Asian community that has multiple ways of transmission, including mother to child. And getting diagnosed should be a regular routine health checkup because it is so common in the Asian community. We hope that they learn about HPV and become more knowledgeable on how it's transmitted and remove the fear of this condition.
Thank you so much for sharing. I still get teary-eyed too whenever I see this video. We've done, like we mentioned before, we've done this workshop 6 times, and just the people that we've met, a lot of times it's interesting to see how much of the shared, how unique each person's experience is, but how a lot of the themes that Kim just talked about keep on repeating. And I know that we do these workshops with small groups at a time, but I do think it has such a big impact on kind of spreading awareness and helping people connect with others and make these realizations that we can see like what the recurring and underlying issues are with getting education and early diagnosis and all of this information out there. So I really do appreciate, again, your participation in the workshop and the ongoing work that you've done. with us for hepatitis B advocacy. I do have just a couple more slides before we do some Q&A, so I'll pull these up really quick. And just so you guys know, Kim's story is on our website at this. I'm gonna play it again. There we go. At hepb.org/justb/Kim. So you can find her story there and all the others. And you know, coming off of what we were able to achieve with the national storytelling campaign, the HepatitisB Foundation also recognized the need to expand globally. And so at this point, while we have not replicated the model of holding workshops, in-person workshops to create digital stories around the world yet, we have launched a story bank and done a bit of audio recording via HepatitisB Foundation staff and partners when we do have events or activities going on in other countries. And so we have launched this online platform called Be the Voice for people living with hepatitis B and also D or Delta, which we haven't mentioned yet, but is another area of work that the HepatitisB Foundation focuses on. And we really launched the first survey in 2020 to try to help identify more people who are interested in sharing their stories, and have asked them to provide, to answer written questions in the form of a Survey Monkey. And then what we do is try to follow up with them to share their stories either visually through social media, using something called storyboards, or when we have had the chance, like I mentioned, if we're able to do recordings. And we've also taken a similar approach where we have voice recordings, although these here that we've done, that my colleague did with a few participants when she was traveling to Nigeria for a project, she was able to capture just sort of one-on-one interviews on using just a few questions that they talked about in advance, and then had asked them, you know, if they were comfortable whether doing it on video or audio. And most of them just wanted to do audio recordings for the same reason that Amy said, that being on camera can be intimidating. But once we were able to edit sort of the clips of the interview and cut it down to maybe 3 minutes, and then we added some photos as well and some visuals to the stories here. And so we're hoping to continue doing this as a solution for now, to be able to reach people who contact us from all around the world, who are kind of really want to be heard and want to be part of this movement to get stories out there, and are living in countries where hepatitis B is also very prevalent, but there's little being done about it. So we wanted to be sure that we were including more of those storytellers as well. So that's kind of where our storytelling efforts are hopefully expanding to and heading to. And you can find out more information about those, both the Be the Voice Story Bank and our JustB workshops here on these websites. And with that, I want to thank everyone again for listening to this overview of our storytelling programs, and I will pass it back over to Raquel for our discussion.
Thank you so much, Ren and Cook and Amy and Yasmin. This has been amazing. I think that a few things that I really liked is the fact that for the storytellers, that the sense of community, that sense of inclusion, and almost like having that home. But also at the same time, I loved hearing how those stories then helps the organization with the awareness, the advocacy efforts to really push the cause forward. And we know we have a massive gap there. And one of the things I was writing down here on my pad is that, I see that there's a lot of awareness, but also empathy, not sympathy, empathy created. And with that, you have action. And, you might know that, but, these are the ingredients. So when we talk about empathy, awareness, and action, these are the ingredients for compassion. And compassionate healthcare is something that everybody, I think, here would agree that is incredibly key and important. So I absolutely loved every single presentation. I have a few questions, one each, because we don't have a lot of time. So let me start with you, Rhea, just because you're the last speaker. And I mentioned, you mentioned something around going global and language being so important. Now, my question to you then is, when resources are always limited, and we know that that's the case, especially when it comes to translations and so on, how can we best utilize storyteller videos that then produced in different languages? I just wondered if you have any tips, if you know that if subtitles or voiceover, like what works best? What's your experience with that?
Yeah, that is something that we do when we're, I guess, preparing for each of the workshops. We ask the storytellers if there is another language other than English that they would like to record their stories in, and that way, all in one go. If they're bilingual, they can do the translation during the workshop and usually be able to record both versions then, and then all it takes is switching out the which audio track goes over the video. And then one thing that I forgot to mention during was that we do, through our program evaluation and through feedback that we've gotten, we have actually, what's different from the video that you just saw versus some of our newer videos is that we've added some health education messaging to the opening or to the ending of each video. And that also adds a layer of, okay, we need this information to be translated if the story is being told in that language too. And so I think it's really important to prioritize that and include that in the budget, especially for hepatitis B, when we know that most of our social media audience is global and a lot of people are looking for resources in language. So when we do put out a video that is in another language, we try to make sure that that we can also point them to, like the other language chapters on our website, or partners who might have information in language. But I do think that it's not, we haven't been able to cover as much as we would like in this, like kind of in that creating more resources that would help fill this gap. But we do recognize, how much people are searching for it. And so I don't know if Yasmin or anybody else wants to add to that, but I do think prioritizing and being able to offer in language resources and for people to see people from their own community or their own culture talking about this information, just like in Cook's video, specifically mentioning Vietnamese cultural aspects that impacted what happened with her father, is so important.
Thank you, Rhea. I had a question for Yasmin. Yasmin, don't hate me because I think I'm going to change my question to you, just purely because, my question was around impact for the HepatitisB Foundation, but I could see through the presentations, all the ways that the HepatitisB Foundation has been using the stories to raise awareness, to mobilize the government and so on via social media. Rhea also mentioned the screenings. I guess my question is, if I'm an organization that wants to start something similar, and I look at this, it can sound a little bit overwhelming. Oh my God, they have a whole program, they have a partnership with storytelling experts. And I just wondered, and maybe to all of you, if you want to start, is there something, it's an easy route, is perhaps like a first thing that you need to do? I just don't want this to become too overwhelming. I think everybody agrees the storytelling is very important, but perhaps not as easy as it sounds, to be able to, as Amy said, find, hear, and then see one story. And I just wondered if, and I guess my question's to Yasmin, but anyone can pitch in as well. What would you say to organizations that are really interested in learning more and doing something similar?
I will give a very simple answer, but then I know Rhea will be able, and Amy as well, to answer that better than me. When I joined the HepatitisB Foundation in 2019, we were celebrating, or they were celebrating at the time that I joined, and I joined the first big team meeting. I think it was like the 14th or something, or maybe I'm wrong, but it was not the 41 videos that Rhea talked about. So definitely start small and then go big, and definitely Rhea will be able to shed more light on that. So, and the other thing about the language, what I would like to add also, maybe along the same lines, we face the same situation, like even not only with storytellers, like we're embarking on a large global public health study right now, and it's going to be in 8 languages plus English. How did we choose that? We would have loved to have like at least 14 languages, but we were constrained in the budget as usual. Resources are always limited, as you said. And we thought like, okay, this could be the most visited languages on our website. So maybe choose 1, 2, 3. This one is like really, they don't have a lot of resources. So there were several factors that we tried to encounter. We used our community partners to reduce the cost of the translation a little bit and review our in language like material, things like that. So partnership and collaboration comes very handy in this. Seeing what others have and kind of like tag along is very important. And in Egypt, we have a very important saying: if you can't have it all, don't lose it all. So just start small and go big. And I'm sure Rhea can talk more about that.
That was a really good point on partnering with people and using what's already out there to fill the language gaps too. So no, I think you covered all of that well. I think it's a good way to summarize it is we had to start small too. I think we had big expectations and still do for like really creating a big storytelling movement. And it has come such a long way, but I mean, I can tell you it's still hard sometimes to recruit people to spend a weekend away doing something that is really scary, which is meeting with a bunch of people they've never met and sharing such personal, intimate details about their lives and talking about health in this way, and then going public by having their video on our website. So I think, yeah, starting small and maybe even just giving people more options, like for those who say that they don't want to participate in a workshop or be on camera at all, we give them options to, you know, maybe use a pseudonym or be anonymous, use different visuals so that they're not feeling so overwhelmed themselves. But I think that's one aspect of the difficulties not to be too discouraged about, because we've faced that too. You know, we were like ready to launch all these stories, but we, you know, still sometimes have difficulty finding people to share them.
Thank you, Rhea. Actually, it's a very good bridge, because my next question was going to be to Cook. You know, Rhea was talking about how difficult it might be to be telling your story. And I just wondered, Cook, and thank you again for sharing. That was beautiful. What really convinced you, and perhaps like what really helped you decide to participate in the storytelling program, especially when you're already mentioned, you know, especially with the Asian culture, the issues around stigma. So what made you go, okay, no, I need to do this?
Yeah, great question. So the very first thing we had to do before we accepted the workshop is that we had to talk to our mom. So we had to ask our mom if it was okay if we shared the story, because it's usually the older generation that is more fearful. For my sister and I, we were educators, so we have some fear in it, but overall we just, you know, it's not about us, it's about our mom. So we had to ask for her permission, and she was hesitant because she didn't want her family members or our church community and others to kind of, you know, look at her differently and treat her differently because of it, because, you know, she was my father's wife and such. But after, you know, she took a while to think about it, and then she said, yep, do it, because your dad would have wanted us to do it. We need to, so that others don't go through the same experience. We're a very close-knit family, so when our father was in the hospital, we were there. He was never alone at any period of time, and it was really stressful and mostly on my mom. So we honored her decision, and that was probably the biggest thing that convinced us and allowed us to be okay with sharing our story, despite the stigma that could be associated with it. And in addition to that, we felt responsible, like we had to share the story, right? Because if it was a condition where it couldn't be easily diagnosed and then early treatment, which led to better prognosis, then it would be a different story. But this is something that you can easily go get tested and such. And so we just went, the benefits versus the possible stigma that could have, occurred to us. We just said, we don't care. After we got our mom's permission, we just said, no, it's our responsibility to share this information. So.
Thank you so much. Actually, thank you. And I'm going to use your tagline for being courageous. Thank you for that. Really appreciate that. Last question, Amy, that goes to you. And it's like we say, like in Portuguese, you said in Egypt, but I'm going to say, so it's like the key, the golden key here, like is an expression. So the last question I have is, Amy, if you had to leave our participants with one key message about today, about all this condensed version of a workshop on storytelling, what would that be?
I think the main message would be that storytelling is valuable in and of itself as a process. So rather than sort of jumping to creating media artifacts or videos, to really think through at the community level how storytelling experiences and activities and processes can support people who are struggling with what it's like to live with Hep B, or support family members who are living with Hep B, and that you don't have to get all fancy with equipment and production to bring people together in a community environment, simply to share and witness and be there for each other through the telling and listening to stories.
Thank you so much. Love that. And with this, I think I'd like to thank you all once again for being here with us today in this condensed version. I know it takes days, but thank you so much for highlighting all of those steps for us. And I think that's it. One last thing is, if you want to know more, as Rhea said, you can go and visit the HepatitisB Foundation website. But for now, just would like to thank the participants once again and say a goodbye from us. Thank you.